Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
Hello, CV Academic members. My name is Julianna, for those who do not know me, and I'm a super mentor here on the platform. Welcome back to the nursing channel, and for those that are new, welcome. I love to see all new faces and those that are returning. Today, I'm creating a video of a recent interview experience that I had to actually obtain one of my dream jobs as a registered nurse. And I just wanted to explain kind of how I prepared and how I can help you prepare, because it is very nerve-wracking. So let's get started. So for starters, the first thing that I did was update my resume. I had been populating this since probably freshman year of college. I had 3 to 4 jobs throughout college, so I was updating it each time I got a new job, had a new volunteer experience. Anytime my educational background changed, I always updated that because it saved me time for this moment. So I updated that and made sure I knew kind of front to back, top to bottom, what was within that, because a lot of times during an interview, the interviewer will ask you questions about this and you want to know what you're talking about. The second thing that I did was figure out where, in terms of location, that I wanted to work once I graduated from nursing school. And from there, once I decided on a certain city, I started to research hospitals within that surrounding area. And there are certain things that I personally researched that some of my mentors had told me to do. Certain things such as the hospital or the organization's mission, their values. Something that you'll learn in nursing school is certain hospitals will be accredited through the ANCC magnet status. So essentially what that means is the hospital is awarded this recognition by demonstrating a roadmap of excellence through with their nursing practices all throughout their facility. And this is an amazing accomplishment. So I personally, as a new grad, want to look for those things, because once you are employed by wherever you are employed by, it's important to know the different mission values and nursing excellence practices that you're going to be upholding as a nurse once you set foot and you begin your career as a nurse. So then once I researched each hospital, I decided which ones fit best with me, my personality, my values, my morals, those kinds of things. It'll be different for everyone, and that is totally okay. Once I decided on that, I wrote up my cover letters. I made them specific to each hospital and each organization that I applied to. And I started applying. Once you start hearing back from different employers or potential employers, I should say, I started researching on Google, what are interview questions for nursing interviews. There's a lot of good YouTube videos out there, and there's a lot of good articles that kind of help guide your thinking, because it can be overwhelming, and I highly suggest prepping for these interviews. I have a few questions that I remember from my interview that I'm going to share with you guys, and maybe tips of how to formulate your answer to these. The first question I was asked, and the one that most of us aren't the biggest fan of, is tell me about yourself. This is a very broad question, so a lot of times it's hard to kind of tunnel your thoughts and be specific to what they're asking you. So rather than talking about, I grew up in a family this big with this many siblings, maybe change your thinking of what that question is into why nursing? Why did you choose this profession of nursing? Once I looked at it in that way, light bulbs went off. And I essentially talked about, what motivated me to get into nursing, what personality traits or adjectives about me would benefit this specific hospital or organization once I start as a nurse. So when you shift that question into that as why did you choose nursing, it becomes more narrow in your mind and in the interviewer's mind, and it makes more sense, and it helps you avoid going on a tangent, because sometimes those are things that aren't the greatest to do in an interview. It's good to stay on point and to actually answer the question. The second thing is, a lot of times interviewers will have scenario-based questions. So tell me about a time when blank. Tell me about a time when you had a difficult patient and how did you deal with it? Tell me about a time you had a coworker that made your day a little bit more difficult, and how did you handle that? And the answer that they're looking for is, how do you deal with stress? How do you deal with complicated situations? How do you prioritize? And if you can answer those in a professional and safe way, following the policies and the procedures of that specific organization, that's the best answer that you can give. I think the last one that I remember them asking me about is asking me to tell me about a time where I prioritize. How do I prioritize? And I talked about clinical situations and how you get report from different nurses. And from there, you go off of, the physiological needs of your patients. Are they stable? Are they unstable? Are they chronic? Is it an acute issue? And I went off the Maslow's hierarchy of needs. So I will put a picture in this article with the video so you can kind of visualize what I'm talking about there. The next thing I want to talk about is what to bring to the interview and what to wear. So first of all, what to bring. Keep it as minimal as you can. I brought 3 to 4 copies of my resume and a portfolio folder. So it's just a folder that you can put your portfolio and your resumes in. And then there's a notepad on the side. And on the notepad, I wrote questions that I wanted to ask the employer. One of the questions I asked was, tell me about your most successful nurse on this unit and what type of attributes or personality traits does he or she practice, and how can I mimic those? So I would keep that list of questions to ask them to 3 to 4, not more than 5. That's just in my own opinion and the research that I did. So I brought my portfolio folder. I brought a little purse just to put my keys in. I had my phone off the second I walked into the hospital, and I had my jacket, and that was it. In terms of what to wear, there's going to be a picture in this article as well for male and female versions of professional proper attire to wear to an interview. I wore just navy blue slacks, a button down, and then a blazer over the top. And I wore little loafer shoes as well. So a lot of times, especially if it's in a hospital setting, they will want you to observe the unit. And to do that, you have to have closed-toed shoes. So I would highly suggest wearing closed-toed shoes so you are able to participate in that. The last thing I wanted to talk about was, once your interview is over, it is important that you write a thank you and you send a formal follow-up email, phone call, or letter to the hiring manager or the individual that hired you personally. I was given a business card with all of that contact information on there. So when I got home, I waited between 6 to 12 hours, not longer than 24 hours, to write a follow-up thank you email, just saying, thank you for your time. I really appreciate being able to observe the unit and talk to you about this position. I believe that I have X, Y, and Z traits to be able to fulfill this role. And I look forward to hearing back from you. There are multiple websites out there that have an outline of a follow-up email to thank the interviewer and the hiring manager. And I find that to be very professional and important to just let them know, like, I am very interested in this hospital and this position specifically, and I can't wait to hear from you. So I just think it's a way of reiterating how much you do want this job and this position specifically. So I wanted to keep this video pretty short, and I was not able to answer all of the questions that I wanted to, but if you have any others that you would like to comment, leave them down below, and I'm more than willing to make another video, answer them via chat, or comment and reply to you directly onto this thread. Thank you guys for watching, and I cannot wait to meet some of you in the nursing channel.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.